Good morning, TRS retirees and families, and welcome to Retire Healthy with TRS Care. My name is Jean Gibson, and I represent your dedicated TRS Care team at the Teacher Retirement System of Texas. Thank you for investing your time with us today. We do take your health care seriously and want you to have all the information you need to successfully navigate the complicated world of healthcare. This presentation will give you a brief overview of the healthcare benefits that TRS offers to retired Texas educators. We'll host a live Q&A session at the end of the presentation. But before we start, I want to share a quick note for Texas higher education employees. If you qualify for a TRS retirement pension and for retirement health benefits from ERS, UT, or Texas A&M, your retirement benefits may come from, your retirement health benefits, may come from the system where you're qualified, either ERS, UT, or Texas A&M. So if you're unsure, please contact your employer to find out if you're eligible for their retirement health benefits. But if you're not eligible for their retirement health benefits, you may be able to enroll in TRS Care. So for those of you new to webinars, let's review a few housekeeping items before we start. All participants will remain on mute during the webinar. If you don't see the handouts pane, select View Handouts in the top menu bar of your control panel. You can take a moment to check your settings and just let us know after the webinar if you still can't see the handouts, and we'll be happy to send those to you. During the webinar, you can submit your questions through the questions box on the GoToWebinar panel. Our subject matter experts are here today, and they will respond to your questions in real time throughout the meeting. Please don't post confidential information in the chat, though. We do have nearly 500 people registered for today's event. Our team will do our best to answer as many of your questions as possible, but if we don't get to your question, no worries. You can always call us or email us. You can find our contact information in the handout called TRS Care Important Contacts. I'll also share our contact information at the end of this presentation. Once we get to the Q&A session at the end, we'll respond live to some of those more frequently asked questions. And finally, if you have connection issues on GoToWebinar, the software that we're using today, please go to their support website listed on the slide. That's support.goto.com/webinar. All right, let's take a look at today's agenda. If you're nearing retirement and thinking about your healthcare options after you retire, you're in the right place. This presentation provides critical information to help you make a fully informed decision about your healthcare during your retirement years. Today, we'll give you an overview of the TRS Care program, including enrollment eligibility. Then we'll talk about the different TRS Care plans, including brief overviews of benefits, the steps to enroll, and the premiums. Then we'll cover special features of TRS Care that TRS specifically designed with retired educators in mind. We'll also discuss TRS Care enrollment opportunities. Unlike in employment, TRS Care medical and pharmacy plans have no annual enrollment period. So it's important to keep track of your chances to enroll in these plans. However, the new TRS Care dental and TRS Care vision plans will have annual enrollment periods. Finally, we'll talk about what will happen after you enroll and then wrap up with that QA session. Our goal is to prepare you to sign up for TRS Care, health benefits that you work for throughout your career and earn for the next phase in your life. TRS is dedicated to being the care you can count on, which is why we want to do our part in preparing you for this next stage of life. So just another reminder, please do ask questions anytime throughout this presentation via the questions box on the GoToWebinar panel. All right, let's roll out the first part of the presentation, which will give you a basic overview of TRS-Care. We'll start with an overview of how we fund and organize TRS benefits. TRS administers 3 trust funds for the benefit of active and retired Texas public school employees. We use the TRS Pension Fund to make retirement annuity payments to TRS retirees. We use the TRS Active Care Fund to pay for health care for working school employees and their dependents. And the TRS Care Fund is a separate fund for TRS retiree health care. TRS Care is our umbrella term for TRS health care plans for retired public employees and their eligible dependents. We'll talk about just these plans today. These 3 funds are established in the Texas Constitution and are held in trust for the benefit of TRS members. They are separate funds and can't be commingled. Each fund is financed differently and can't be used for anything other than its original intended purpose. And as you can see from the slide, TRS finances the TRS Care Fund with contributions from participant premiums, state funds, federal funds, school districts, active employees, investment income. But most of the funds come from the premiums that you pay monthly and funding from the state of Texas. As I mentioned earlier, TRS offers and manages distinct health plans for working and retired educators. We'll cover the TRS retiree health plans in today's presentation, including TRS Care Standard for retirees not yet eligible for Medicare, and TRS-Care Medicare Advantage, which includes TRS-Care Medicare Rx for retirees eligible for Medicare, and TRS-Care Dental and TRS-Care Vision for any TRS retiree, regardless of their Medicare status. I'll talk about who is and who is not eligible for Medicare in more detail later. But the difference that affects most people is whether or not they've turned 65. You can also find relevant information about this topic on our website. You can look for links in the handout called TRS Care Important Contacts. Now let's look at the eligibility requirements. If you're eligible for TRS Care, that means you worked for and paid for this benefit. You've earned it. So who can enroll in TRS Care? 3 groups of people can enroll, including service retirees, retirees with disabilities, and eligible dependents. The eligibility requirements are the same for all TRS Care health plans. I'll note again that if some or all of your service is with ERS, UT, or Texas A&M, you may be eligible for their retirement health coverage. So let's review service retirees first. Service retirees meet one of these requirements when they retire. So the rule of 80 means that your age when you retire plus your years of public school service, which includes ERS, Texas A&M, and UT, must equal 80. You must also have at least 10 years of service credit. Alternatively, you can have 30 or more years of service in TRS regardless of your age. A person can also buy service credit. If you have questions about buying service credit, please visit the TRS website. There are rules about when you must pay for it in order for it to count for your pension and to establish your eligibility. They're not part of this presentation, but if you're buying service credit, it's important that you understand those rules. If you need a link to those rules, just ask one of our subject matter experts to share a link in the questions box. The name of the page is called purchasing service credit. All right, so let's do a quick pop quiz on service retirees. Judy is 48 years old and started working at age 18 in the admin office. When she retired, she had 30 years of service credit. Is she eligible for TRS-Care? And you can put your answers in the questions box. I'll give you a minute. And the answer is yes, but why? Even though she does not meet the rule of 80, her age of 48 plus her 30 years of service equals 78. She has 30 years of service. Pat is 57 years old and worked for 20 years as a music teacher, after which she decided to retire. Is she eligible for TRS-Care? I'll give you a moment. And the answer here is no, not quite yet. She does not meet the rule of 80. Her age of 57 plus 20 years equals 77, and she does not have the 30 years of service credit yet. But she is eligible to retire soon. She just has to get a little older and work while she's doing it. TRS retirement can help her figure out those details. And finally, Jim is 75 years old and has 5 years of service credit as a librarian. Is he eligible for TRS-Care? See those answers coming in. All right, the answer there is no. While he does meet the rule of 80, 75 plus 5 equal 80, he does not have the required minimum 10 years of service credit. So you can call TRS Health if you need help figuring out when you become eligible as a service retiree. All right, let's review retirees with disabilities. When the TRS Medical Board approves retirement for a person with disabilities, they also become eligible for TRS-Care. And once they're enrolled in TRS-Care as a disability retiree, they can continue to participate as long as they remain a TRS disability retiree. Special rules do apply to disability retirees with fewer than 10 years of service credit. So if this is you, please do reach out to TRS Health to better understand your disability benefits. If you do apply for health coverage because of a disability, TRS may ask you to validate your Medicare Social Security disability status, but don't be surprised if we ask. We just want to make sure you get all the benefits to which you're entitled. All right, let's move on to eligible dependents. Retirees can cover the same types of dependents under TRS-Care as they could under TRS Active Care. And this includes your spouse, including a common law spouse, a child under the age of 26 who is also a biological child, an adopted child or one lawfully placed for adoption, a foster child, a stepchild, or a grandchild who lives with you, depends on you for support, and who you claim for federal income tax purposes. And the last group is children, regardless of age, with a mental or physical incapacity who depend on the retiree for care and support. Some types of dependents require documentation to establish eligibility. For instance, we do call out adopted children only because there are different documents that we need, not because TRS thinks less of these relationships. As for spouses, I wanted you to be aware of two things. First, in the event of a divorce, the dependent spouse is no longer eligible for coverage unless they're also an eligible TRS retiree, although COBRA coverage is available. And second, if the retiree should pass before their spouse, the spouse will continue their coverage. Okay, as I mentioned earlier, TRS-Care offers distinct health plans for retired public school educators and their eligible dependents. TRS-Care Standard is for people without Medicare or people under age 65. Blue Cross and Blue Shield of Texas and Express Scripts administer the 2025 plan for TRS-Care Standard. TRS-Care Medicare Advantage and TRS-Care Medicare Rx are for people with Medicare. Generally, that's people who are age 65 and older. United Healthcare and Express Scripts administer those plans. And TRS-Care Dental and TRS-Care Vision are for any TRS retiree, regardless of their Medicare status. MetLife will administer those plans. And one thing I'll note is that you do not have to be enrolled in TRS-Care Standard or TRS-Care Medicare Advantage to enroll in dental, vision, or both plans. Our plans offer comprehensive benefits to meet your medical, prescription, dental, and vision needs, as well as wellness programs to help you achieve optimal health outcomes. We'll cover this information in the next few slides. Now, I'll briefly hand the presentation to Blue Cross and Blue Shield of Texas to cover TRS-Care Standard medical benefits.
Who are not yet eligible for Medicare. Hi, I'm Laura with Blue Cross and Blue Shield of Texas, and I will cover the medical benefits for TRS retirees who are not yet eligible for Medicare. TRS-Care Standard is a high-deductible health plan for retirees and for their family members under age 65 who are not yet eligible for Medicare. Blue Cross and Blue Shield of Texas and Express Scripts administer this plan for the 2025 plan year. If you currently work for a TRS Active Care participating employer and are familiar with those plans, the TRS-Care Standard plan is most like the TRS Active Care High Deductible plan. This plan provides access to a nationwide network within and out of network coverage, and you're not required to have a designated primary care physician, and referrals to specialists are also not required. Additionally, you have access to medical care from the comfort of your home through ReadyMD and Teladoc. You also have access to virtual mental health care through Teladoc. Opting for virtual visits is generally cost-effective and convenient. Express Scripts offers several benefits that help you afford your prescriptions. Certain preventive generic drugs are available at no added cost to the TRS-Care Standard plan. Express Scripts also offers Save on SP. It's a copay optimization program to help participants save money while eliminating member cost share for specialty medications and for providing a best-in-class plan member experience. With TRS-Care Standard, you have 24/7 access to personal health guides who can help you with almost anything related to your health plan, like finding a network provider, understanding medical bills, how certain benefits work, and much more. You can call them at 866-355-5999 or go to the Blue Cross website at www.bcbstx.com/TRS-Care Standard to chat with one of them online. You also have access to 24/7 nurse line through Blue Cross and Blue Shield of Texas. And again, these numbers and website will be on the back of your card. Now I'll hand it back to TRS to cover the enrollment process for TRS-Care.
Thank you so much, Laura. All right, let's talk about the enrollment steps for TRS-Care Standard for retirees under age 65. When you retire, you have what we call your initial enrollment period. These are the steps that you take if you're under 65 when you retire. Step 1, you'll submit your application for service retirement to the TRS Retirement Department. Step 2, after TRS Retirement approves your application, you'll get a TRS-Care enrollment packet by mail that includes an application for TRS-Care. So it's very important that TRS has your correct address on file so that you'll get this packet in time to enroll. Step 3, you'll complete the application and send it back to TRS in the required time frame. Again, when you submit your application, make sure your address is up to date so that you get your TRS-Care enrollment packet after the retirement department processes your retirement application. The packet will have an application form for you to enroll yourself and your dependents in TRS-Care. You must return this form within a certain period, which we'll talk about in a few minutes, but be sure to pay close attention to that date. And be sure also to contact your school official to double check when your health coverage will end. You'll want to coordinate that date with your TRS-Care start date. But you don't need to return this form to TRS if you choose not to enroll. However, keep in mind that if you don't enroll during your initial enrollment opportunity, or you enroll and then later drop your coverage, you'll only have a few opportunities to enroll later. But I'll talk about that later too. This slide shows the premiums for TRS-Care Standard, the plan for retirees without Medicare. These rates have remained the same for the 8th year in a row. Retirees with Medicare have different premiums. The retiree's Medicare eligibility status determines which set of premiums you need to look at. So if the retiree is not eligible for Medicare when they retire, but their spouse is, this is the set of premiums you should look at. In the same way, a retiree who is age 65 or older with a younger spouse would use the TRS-Care Medicare Advantage premium table to figure out their cost. Disabled dependents of any age can stay on the retiree's health plan after age 26. If that's your situation, you'll have a $200 lower premium. All right, let's switch gears and talk about TRS-Care Medicare Advantage and TRS-Care Medicare Rx, the plans for retirees who are age 65 and older and eligible for Medicare. The first thing you need to do is find out if you're eligible for Medicare. All right, what makes you eligible for Medicare? Medicare is for people who are age 65 or older, or they're medically disabled and under age 65, or they're any age with end-stage renal disease. Medicare is a federally funded health insurance program administered by the federal government's Social Security Administration and the Centers for Medicare and Medicaid Services, or CMS. People do sometimes confuse Medicare with Medicaid, which is for people with low incomes. But Medicaid and Medicare are two separate programs. Medicare is funded by federal payroll taxes, or FICA, on your pay stub. FICA is the Federal Insurance Contributions Act. Your employer deducted FICA taxes from your paychecks throughout your careers. So let's review what Medicare is, who's eligible, what it covers, and what TRS-Care Medicare Advantage covers in addition to traditional Medicare. So United Healthcare administers our TRS-Care Medicare Advantage plan. This plan provides medical benefits. People eligible for this plan include TRS retirees and their family members who are enrolled in Medicare and are also age 65 or older, or they're certified as disabled by CMS. So if you worked 40 quarters or 10 years, you are eligible to enroll in Medicare. Part A covers hospital expenses. Part B covers doctor visits and other outpatient care. And Part A and B together are what is called traditional Medicare. There's also Part C, which you can think of as a combination of A and B plus some other benefits. That's what the TRS-Care Medicare Advantage plan is. TRS knows that most Texas educators don't pay into Social Security, so they're not eligible for premium-free Part A. But I do have good news, our plans do not require it. Most Medicare Advantage plans do, and that may be an extra cost for you. This is just another way that we design TRS health plans with the needs of Texas educators in mind. However, you do have to enroll in and pay for Medicare Part B. This is true for any Medicare Advantage plan. As I said, TRS-Care Medicare Advantage plan is a Part C plan, which comes with some extra benefits. In a moment, our United Healthcare representative will talk about some of those benefits, but one that I want to be sure that you focus on is prescription drug benefits. Almost everyone uses that, and the TRS-Care Medicare Rx plan prescription benefits are very generous. So in summary, if you remember anything from this slide, remember these two things. First, if you're not eligible for premium-free Part A, don't worry. Your benefits under TRS-Care Medicare Advantage are the same. But if you can get Part A for free, you should sign up for it. Second, after you enroll in Part B, be sure to keep paying your Part B premiums. If they lapse, you risk losing all TRS care coverage for yourself and your covered dependents. And that is what I meant by the complicated world of health care. So we are here to help you. If you want to just give us a call or ask our subject matter experts questions, we're here. Now I'll hand the presentation to our United Healthcare team to go over your TRS-Care Medicare Advantage benefits.
Thank you, Jean, and good morning. My name is Lacey with United Healthcare. Today, I'll briefly provide an overview of your TRS-Care Medicare Advantage benefits and highlights. TRS-Care Medicare Advantage is for retirees and their family members enrolled in Medicare. TRS-Care Medicare Advantage includes both a medical plan and a prescription drug plan, with the medical plan being insured by United Healthcare. TRS-Care Medicare Advantage offers a large nationwide network of doctors and hospitals. You can see any provider that accepts Medicare and will bill United Healthcare, which means your costs will remain the same for both in and out of network coverage. Other Medicare Advantage plans on the marketplace may offer lower premiums by offering small networks of doctors and hospitals. They also keep premiums low by not covering medical services by providers that are not in the network except in emergencies. On the other hand, TRS-Care Medicare Advantage has predictable copays, plus a low medical deductible and out-of-pocket maximum. You have low doctor visit copays, such as a $5 sick visit with a primary care provider and $10 for a specialist visit after you met your deductible, and single $500 inpatient hospital admission copay, regardless of the number of days that you stay. Although the monthly premium may differ than some plans, your benefits from more predictable costs when getting your medical care with TRS-Care Medicare Advantage. Some other plan premiums increase each year with your age. So a lower premium this year doesn't guarantee lower premiums in the future. However, TRS care plans have no age-related premium increases. TRS Care Medicare Advantage also gives you access to a wide variety of wellness programs through United Healthcare, such as Silver Sneakers, Real Appeal, and more, which we'll cover in the next slide. With TRS-Care Medicare Advantage, you have a list of benefits that we refer to as value-added benefits. Value-added benefits are additional benefits within your plan that are available to you at no additional cost and benefits that I hope you take full advantage of. Healthy Benefits Plus. This gives you a $40 allowance every 3 months to purchase over-the-counter products. This is preloaded every quarter, and the balance can roll over quarter to quarter, just not annually. With your $40 allowance, you can purchase over-the-counter products such as vitamins, Band-Aids, pain relievers, medical supplies, canes, and more. Routine Vision. This gives you a $0 vision exam and an annual eyewear allowance of $70 for lens and frames or $105 for contact lens. Routine Transportation. This gives you a 24 one-way or 12 round-trip rides per year up to 100 miles each way. Rides are available to and from medically related appointments and pharmacy trips. In-home personal care. This helps you with daily living activities such as meal prep, laundry, shopping, bathing, medication reminders, and also companionship. You receive 8 hours per month. These hours do not roll over month to month. Silver Sneakers is our fitness membership. It gives you access to a free basic gym membership at any participating Silver Sneakers location and access to group exercise classes at participating locations. Hearing exam gives you a $0 hearing exam and a $500 allowance every 3 years for hearing aids when using UHC hearing. And finally, virtual visits. You have access to a licensed provider 24/7 when using virtual visits with Amwell, Teladoc, and Doctor on Demand. You can speak to a doctor about any symptoms that you're experiencing, such as a pink eye, sore throat, cold, cough, and flu. They'll write a prescription for you and send it to a pharmacy of your choice, and you'll never have to pay for this service. Again, I hope these are benefits that you take full advantage of. I want to say thank you for spending a brief moment with me. Please continue to use the chat to ask any questions regarding TRS-Care Medicare Advantage. And now I'll hand the presentation over to Express Scripts.
Thank you, Lacey. Hello, everyone. My name is Cartier Foster, and let's talk about your TRS-Care Medicare Rx benefits. So the first thing I want you to know is that the TRS-Care Medicare Rx plan provides a richer benefit than what you would see on those individual or marketplace Part D plans. Let's take a look at what that includes. So this plan has no pharmacy deductible. No matter what stage of the Medicare Part D process you're in, you'll pay your flat, predictable copays. You will also have access to a very broad network of retail pharmacies, which includes all the large pharmacy chains such as CVS, Walgreens, Walmart, Target, HEB, and many more. Another great aspect of the TRS-Care Medicare Rx benefit is a 90-day supply option through the Express Scripts home delivery service or through those large retail pharmacies I just mentioned. TRS-Care Medicare Rx has no large out-of-pocket costs for brand or specialty drugs. Again, you'll pay your flat, predictable copays with this plan displayed in the table. So with that said, let's talk about your copays. In this table, we've broken out the copays for a 31-day supply and a 90-day supply. Our 31-day supplies at a retail pharmacy look like this. A generic prescription copay is $5. A preferred brand copay is $25. A non-preferred brand copay is $50. And specialty medications, or those high-cost meds, are also $50 as well. Now you can get 90-day supplies at retail pharmacies or through the Express Scripts home delivery. The generic copay is $15. Your preferred brand copay is $70. Your non-preferred brand copay is $125. You will notice the copay for specialty medications is not applicable. Specialty or high-cost tier drugs are limited to a 31-day supply, and the largest driver behind that is to control waste. Many times when new prescriptions are issued, they're for a recent condition or the person is trying a new medication. Often, these new medications can come with side effects. For example, itchy skin or headaches, and you find out that medication won't work for you or your lifestyle. So what happens to the rest of the medication? Well, it gets tossed in the trash, and often these are very expensive medications. To control costs and keep premiums down, we limited the specialty high-cost tier to a 31-day supply, so you will not be able to fill these for a 90-day supply. Now, if you have unused medications, you can properly and safely dispose of them at most of your local pharmacies. Most pharmacies will accept unused medications for safe and proper disposal. So now let's transition back to TRS.
Thank you so much, Cartier. All right, let's talk about TRS-Care enrollment steps for people who are eligible for Medicare. When you first retire, you have what we call your initial enrollment period. If you're under age 65, later you will get what we call your age 65 enrollment opportunity. If you're already age 65 or older when you retire, these two enrollment opportunities are combined. So if you're age 65 or older when you retire, you must complete steps 1 through 4 to enroll. If you don't want to enroll, you don't need to return the form to TRS. Just keep in mind that this is likely your last chance to enroll in TRS Care. If you retired before age 65 and stayed enrolled in TRS Care Standard, you'll have to complete steps 3 and 4 to have a smooth transition to TRS Care Medicare Advantage and TRS Care Medicare Rx. In addition, your 65th birthday is also your age 65 enrollment opportunity and your chance to add more dependents. Throughout your 64th year, TRS will send you reminders to complete step 3. 6 to 8 weeks before your 65th birthday, TRS will send you an age-in packet that contains a TRS Care application. Again, you don't have to return this form to TRS unless you want to add or change your dependents. I'll repeat that. You don't have to return the form to TRS unless you want to add or change your dependents. So let's review the steps. Step 1, you submit your application for service retirement to the TRS Retirement Department. Step 2, after TRS Retirement approves your application, you'll get a TRS Care enrollment packet by mail that includes a TRS Care application. Step 3, in the meantime, you want to enroll in Medicare. Be sure to sign up for Medicare Part B if you haven't already, and share your Medicare beneficiary identifier or your MBI or your Medicare number with TRS. Complete the TRS Care application and send it back to TRS in the required time frame. So if you retired before you turned 65 and didn't enroll in TRS Care at the time, or you let your coverage lapse, you also have an age 65 enrollment opportunity. And this is your next chance and likely your last chance to enroll in TRS Care. TRS will send you a postcard to the address that we have on file, reminding you of this opportunity. So please keep your address current. The postcard will tell you to contact TRS to request a form if you want to enroll. You can do this and complete steps 3 and 4. We recommend that you start this process about 90 days before you turn 65. And a quick public service announcement. Whatever you do about TRS Care, you first become eligible for Medicare when you turn 65, and you must enroll in Medicare. If you don't, you risk a penalty. You can contact the Social Security Administration for more information on that penalty. If you're enrolled in TRS Care Medicare Advantage or any other Medicare Advantage plan for that matter, you must be enrolled in and stay current on your Medicare Part B premiums. If you don't, you risk losing all TRS Care coverage for you and your covered dependents. All right, now that we covered eligibility criteria, and the enrollment process, we'll cover what all this costs. As I said earlier, the TRS retirees Medicare status determines if they pay TRS Care Medicare Advantage or TRS-Care Standard premiums. You may have heard that TRS is lowering TRS-Care Medicare Advantage premiums for the 2025 plan year, and the decreases are significant. Take a close look at those numbers in green, if you would, for the most notable points. The cost for retiree-only premium decreases by $60 from 2024 to 2025. Retiree and spouse monthly cost decreases by $249 a month. Retiree and children cost decreases by $60 a month. And retiree and family cost decreases by $407 a month. So we're obviously thrilled to pass along these cost savings to you. You'll also notice that TRS-Care Medicare Advantage premiums are lower than TRS-Care Standard premiums. For instance, the TRS-Care Standard premium for a retiree and their spouse is $689 per month, even if the spouse gets Medicare. Once the retiree gets Medicare, the retiree and spouse premium drops to that $280 a month for 2025. The premium you pay TRS will most likely be withheld from your annuity payment. You will also have a separate Part B premium. As I said earlier, if you are eligible to get Medicare Part A for free, you need to sign up for that. But everyone must pay for Medicare Part B, which Medicare will deduct from your monthly Social Security or Railroad Retirement Board benefits. If you don't get either of those, Social Security will bill you directly. So in 2024, most people pay $174.70 per month for Medicare Part B. This number does change every year, and they usually announce it in December. The standard Medicare Part B premium for 2025 is projected to be around $185 per month, but this number is not yet official. You'll need to visit medicare.gov for the final amount when they announce it. Should you be lucky enough to be in a higher tax bracket, you may have to pay more than this amount. If you think this might be you, you should contact Social Security. And please see that note about continuing to pay for Medicare Part B. It's pretty important to keep your coverage. All right, if you want to learn more about TRS-Care Medicare Advantage plan benefits and enrollment steps, I encourage you to sign up for a TRS-Care Medicare Advantage and You webinar. We do host these virtual webinars every quarter for participants who will soon be eligible for Medicare. These live sessions will guide you through the process and help you understand how Medicare enrollment works. You can register at the TRS Healthcare Events webpage listed on the slide, or click the link in your TRS Care Important Contacts handout. We are excited to announce that dental and vision benefits are coming to TRS Care in 2025. This coverage includes TRS retirees, their dependents, surviving spouses, and surviving dependent children. So let's review TRS Care Dental and TRS Care Vision eligibility and enrollment. The eligibility requirements for TRS Care Dental and TRS Care Vision are the same as the requirements, to qualify for any other TRS Care plan. When can you enroll in TRS Care Dental and TRS Care Vision? TRS will offer an annual enrollment period for these two plans. The annual enrollment period for this year is from October 1st, so it already started, to December 7th. If you enroll during this time, your coverage will start on January 1st, 2025. Once you enroll, you are enrolled for the entire calendar plan year, which is January 1st through December 31st. You don't need TRS-Care health coverage to enroll in these plans. You can enroll in dental, vision, or both plans. TRS-Care Dental and TRS-Care Vision are two separate plans, each with their own premium, and MetLife will administer both of those plans. So how can you enroll? Either by phone or by mail. TRS expanded its phone hours for TRS-Care Dental and TRS-Care Vision enrollment this fall. Starting October 1st, as I said, you can call TRS Help on Monday through Friday and also on Saturdays at that number on the screen. You can also mail an application. Eligible retirees should have received an enrollment application in the mail over the summer. Just fill that out and send it back to TRS by December 7th for your coverage to start on January 1st, 2025. Also, if you're interested in that, we do have an entirely separate webinar devoted just to our dental and vision plans. You can sign up to learn more about these plans at that TRS Healthcare Events webpage, and the link is in the important contacts handout. In the meantime, though, the MetLife team is here today to give you a brief overview of your dental and vision benefits. So I'll hand the presentation over to them briefly.
Great. Good morning. Jean, can you hear me okay?
I can. Hello.
Great. Hello. Hi, everyone. This is Tina Brown with MetLife, and we are so excited to be joining the TRS family effective January 1, 2025 as the dental and vision carrier that TRS has chosen. So, Jean, let's move to our next slide and talk about some dental highlights. All right, so let's talk about staying in network. Great way to save money. Using an in-network dentist means you save between 30 to 45% off of the usual and customary rate that your dentist is charging. PDP Plus is the name of your nationwide network. So whether you are traveling or at home, we want to offer you options. Now, I mentioned traveling. MetLife offers international dental travel assistance to our members for emergency care. If you are outside of the U.S. and have an unexpected, let's say, cracked tooth, for example, you can call our dedicated travel assistance 800 number, available 24/7, and they'll help you find out if there is a Western credentialed dentist in your area. Now, flexibility is key, and with MetLife Dental, whether you're planning to go in or out of network, just keep in mind going in network saves you money. Spotlight on oral health highlights the providers in our network who embrace preventive care. So you'll see when you're looking for dentists in our network that some of them may have a green banner next to their name, and those are our Spotlight dentists. Now, incentive provision. This is definitely a teaser, but it is a way to earn additional benefit dollars by consistently having preventive care services. So this is a way to increase your annual benefits maximum, either for you or any covered dependents, by annually getting preventive care. Now, keep in mind, there are no waiting periods on this plan. All right, let's go to our next slide. Let's review the rates. So these are monthly, and these premiums are taken out of your annuity. So for retiree only, it is $41.64. Retiree plus spouse, $83.29. Retiree plus child or children, $87.45. And then retiree plus family, $129.93. And these are per month. Want to also direct you to the metlife.com/info/TRS-Care or the QR code to look at plan summaries to see more details about the dental plan. All right, let's go to our next slide, and we're going to talk about the new vision coverage. So, Jean, our next slide is where I want to reemphasize this is the new vision coverage through MetLife through our partnership with TRS, and it is effective January 1, 2025 if you enroll. I do want to direct you to the top right-hand corner where it says Superior Vision, because this is your vision network. And this coverage gives you an eye exam once a year, which then gives you the prescription to use the plan to purchase either glasses or contacts every year. Now, there is also coverage for a separate diabetic exam, and this also includes A&D. A huge part of vision coverage are the discounts you receive for lens enhancements if you're a glasses wearer. Now, additional discounts are going to include 20% off of additional pairs of glasses and contacts, because remember, you're staying in network. Also, through our partnership with QualSight, there is a discount for laser vision. So QualSight providers can be found at QualSight.com, QualSight. And again, this is through our partnership with QualSight, so it will take you to a different website. Now, also, wanted to let you know about our partnership with Your Hearing Network, and that's where you can find a free hearing exam and discounts up to 40% off of hearing aids. Now, for any of these discounts, you do need to be enrolled in the vision plan. So if your spouse wants to take advantage of these discounts, they would need to be enrolled in the vision plan. If you want to take a look at those hearing aid locations, again, that's Your Hearing Network, YOURHEARING network.com. All right, so we've talked about enrollment, but once again, I want to give a shout out to the Vision Network, Superior Vision. All right, Jean, let's go to our next slide and let's just review the rates. All right, so these are monthly, and these also will be taken out of your annuity monthly if you enroll. Retiree only, $6.89. Retiree plus spouse, $13.79. Retiree plus child or children, $15.57. And then retiree plus family, $24.08. And again, down at the bottom is that website you can go to see more information on the dental or the vision. And then we've got that QR code that will take you to the same place. All right, Jean, I'm passing it back to you.
Thank you so much, Tana. And let's talk about why you should choose TRS-Care. When you're choosing between TRS-Care plans and other plans, take note that there are key differences between plans. It's important to know what you're looking for to make the best choice for you and your family. One of the most important aspects to consider when evaluating your health insurance options are your needs. Your monthly premium is only a part of what you'll want to consider, but it's not the only thing. Rates are easy to compare, so let's talk about benefits. Lower premiums might mean fewer benefits or a higher annual deductible, higher coinsurance, or higher copays, or a bigger maximum out of pocket or a higher rate for hospital stays. And of course, you'll want to look carefully at the prescription drug plan, including what coinsurance and copays you must pay to get your prescriptions. Make sure the drugs you currently take are covered and that the plan you choose has good coverage for specialty medications. And with that in mind, we'll talk about what TRS-Care plans have. They have competitive rates and rich benefits, no age-related premium increases, flat rates for specialty medications, nationwide networks of providers and hospitals, leverage size, and more. So please take a moment to check out the Medicare comparison flyer in your handout section. You can use this guide to make an informed decision about your Medicare coverage. All right, let's take a quick moment to compare TRS Active Care medical and pharmacy benefits to TRS-Care medical and pharmacy benefits. These plans do have some key differences. TRS Active Care covers active employees and their dependents, whereas TRS Care covers retirees, surviving spouses, and their dependents. Blue Cross and Blue Shield of Texas and Express Scripts administer TRS Active Care and TRS Care Standard. United Healthcare administers TRS-Care Medicare Advantage, and Express Scripts administers TRS-Care Medicare Rx. All TRS Care plans offer nationwide coverage and out-of-network coverage, whereas only some TRS Active Care plans do. TRS Care plans are not regionally rated. In other words, the premiums for TRS Care are the same across the state. TRS Active Care plan premiums vary according to the region of Texas you're in. TRS Care plans do not require a PCP, a primary care physician, whereas some TRS Active Care plans do require a PCP. Out-of-pocket costs vary by all the plans, but they are the lowest on TRS Care Medicare Advantage. All TRS plans cover preventive care at 100% and offer virtual health options. TRS Active Care plans don't currently offer dental or vision benefits, and the TRS Care Medicare Advantage plan offers limited vision benefits, And the good news is that TRS Care will offer dental and vision benefits starting January 1st, 2025. So be sure to register for that dental and vision webinar. All right, now that we covered the plans, let's talk about enrollment windows. I already talked about some of this, but it's important, so let's review it again. As a reminder, TRS Care medical and pharmacy plans do not have an annual enrollment period. Enrollment for medical and pharmacy coverage is available only during specific windows of opportunity. So overall, TRS gives you 3 chances to enroll in TRS Care medical and pharmacy coverage. Number 1, the first chance you get is when you retire. The second chance is when you turn 65 or become Medicare eligible. And the third is if you have a special enrollment event. So we'll cover each of these 3 instances in the next few slides. And really quick, this information is not on the slide, but TRS is also offering a limited time enrollment opportunity, which allows Medicare eligible TRS retirees and their eligible dependents to enroll in or rejoin TRS Care Medicare Advantage. And I'll go over that opportunity in a moment. All right, your initial enrollment period. It can be a little confusing about when it starts. Your enrollment period starts on whichever date is later. The date that TRS gets your retirement application or on your retirement date. You have at least this much time to enroll. The month you retire plus 3 months after the month you retire. Your enrollment period ends 3 months, but at least 90 days after your retirement date or after TRS gets your TRS retirement application, whichever date is later. And that is complicated. So what you need to know is that whichever of these things you do last, you have 90 days after that to submit your TRS Care medical and pharmacy coverage application. After that, you must wait to enroll when you turn 65 or if you have a special enrollment event. So let's look at an example to explain this. If you retire on May 31st and TRS gets your TRS Care application by August 31st, TRS can enroll you. However, if you retire on May 31st and TRS gets your application on September 1st, you missed your initial enrollment opportunity and you'll have to wait until you turn 65 or have a special enrollment event. Your second opportunity occurs when you turn 65 or when you become Medicare eligible due to a disability or if you have end-stage renal disease. If you're already on TRS-Care Standard, this is also your chance to add your eligible dependents. I already explained the steps to enroll, but in case you forget, you can always call TRS Health at 1-888-237-6762. We'll give that number in the last slide to get an application, and one of our counselors will review the steps with you. Remember, you'll need your MBI, your Medicare Beneficiary Identifier, before your coverage starts. So you'll need to apply at least 3 months before your 65th birthday, or start applying 3 months before your 65th birthday. At the start of the presentation, I also said that if the retiree should pass before they turn 65, the surviving spouse is also eligible for benefits. But unfortunately, unless the spouse is enrolled in TRS-Care Standard, we won't be able to send them the needed reminders. So please make sure they know they can enroll, but they will need to contact us. And another little important detail, this enrollment opportunity is for the retiree. So if a 63-year-old retiree who is not enrolled is married to someone who turns 65, that is not an enrollment event. We have to wait until the retiree turns 65. After this turning 65 enrollment opportunity, the only one left is called the special enrollment event. So your coverage starts when TRS gets your TRS Care enrollment application. Hold on, let me see. Did I skip a slide? No, I did not. Apologies. So, effective date of coverage. Your coverage start date depends on when TRS gets your TRS Care enrollment application. If we get your application before your effective retirement date, your coverage starts the day of the month after the month of your effective retirement date. If we get your application after your effective retirement date, but within your initial enrollment period, your coverage starts the first day of the month after TRS gets your application. All right, now we'll talk about special enrollment events. TRS has two general categories of special enrollment events. When you have an involuntary loss of comprehensive health coverage through no fault of your own, or when you get a new dependent. If either of these things happen to you or an eligible dependent, you must notify TRS and we must get your application within 31 days of the event. So what counts as an involuntary loss of other comprehensive coverage? The key is through no fault of your own. So if you're otherwise eligible for TRS care and have documentation like a notice of termination letter that you or an eligible dependent not on your plan left another employer or lost a job and also lost the associated comprehensive health coverage, you can enroll within 31 days following the loss of that coverage. If you, the retiree, were on your spouse's coverage and not enrolled in TRS care and lose the coverage, that too is a special enrollment event that will allow both the retiree and their eligible spouse to enroll. Among other possible events, the following events are not special enrollment events: dropping other coverage because premiums increase, termination of coverage for failure to pay your premiums, and termination of coverage for cause, such as making a fraudulent claim or misrepresenting anything on the application. Remember, too, this is a loss of comprehensive health coverage, not disability, long-term care, or life insurance. And regarding new dependents, a retiree or surviving spouse enrolled in or otherwise eligible for TRS care who gets a new dependent who's eligible through marriage, birth, adoption, placement for adoption or guardianship must also notify TRS within 31 days of the date that they get that dependent. So for that enrollment to be valid, we need to hear from you within 31 days. TRS does require documentation to establish eligibility for all new dependents, including common law marriage. A declaration of common law marriage must be on file with a government agency for it to be valid. So life has to be pretty complicated in order to have a special enrollment event, and that's not typically what anyone wants when they're in retirement. So don't skip one of your other enrollment opportunities and count on a special enrollment event, and just enroll when you can. All right, earlier I mentioned a limited time enrollment opportunity. A healthy TRS Care fund balance, recent federal Medicare changes, and TRS's careful management, plan management ensured the long-term stability of the TRS Care Fund. And this allowed us to make positive changes to TRS Care Medicare Advantage and reduce premiums for Medicare retirees. So to allow retirees to return to TRS Care Medicare Advantage with these new lower premiums, we opened a limited time enrollment opportunity. So this opportunity is available only to Medicare eligible retirees or surviving spouses age 65 or older if you were eligible for TRS Care benefits programs when you retired, even though you didn't enroll. If you were previously enrolled in TRS Care and terminated your coverage, and if you're a surviving spouse and or dependent of a deceased TRS Care eligible retiree. So you can enroll from October 1st, 2024 through March 31st, 2026. You may also add your eligible dependents when you enroll. Under this opportunity, your TRS Care coverage effective date will be the first day of the following month that TRS gets your completed and approved application, but no sooner than January 1st, 2025. And of course, this is just a one-time opportunity. You can't go in and out. So if you'd like to learn more, you can visit the TRS website or just give us a call. Earlier, I said that during your initial enrollment opportunity, you should confirm with your employer when your coverage ends. Not only do you want to avoid a gap in coverage, you also want to be sure you're not paying for coverage twice. So let's look at an example, If your retirement date is May 31st, you may defer your TRS Care coverage start date, which is normally June 1st, to either July 1st, August 1st, or September 1st. You can defer your start date by choosing your coverage effective date. Otherwise, it will be effective on the first day of the month after we get your application. So you might want to defer the start date of your coverage, but you do have to still submit your paperwork on time. You can make changes to your coverage during your initial enrollment period, and that includes things like adding or dropping a dependent. After your initial enrollment period, you can drop a dependent anytime. The soonest start date will be the first of the month following the date TRS gets your completed written request on the dependent termination form. After your initial enrollment period, you can add a dependent only if you have a special enrollment event or when you turn 65 at your age 65 enrollment opportunity. All right, now let's talk about what you can expect after you enroll in TRS Care. What should you do after you enroll? You keep a lookout for your ID card and plan materials in the mail. When you get your ID card, you can sign up for your secure online personal account. From that account, you can look up your latest claim information, review benefit information and plan materials, print a temporary ID card or ask for a new one, search for network doctors, view your plan documents online, and of course, start using your TRS-Care plan benefits. You can simply use your TRS-Care medical card, ID card, each time you go to the doctor, and use your prescription ID card to fill a prescription. You also have access to a dedicated customer care team to help you with anything related to your TRS-Care plans. And a special note about return to work retirees. We know many people return to work for school districts, and it's great to see people stay active during retirement. A recent Medicare rule change called the Medicare Secondary Payer Rule gives Medicare eligible retirees new options that we want you to know about. If Medicare eligible retirees return to work for an employer that participates in TRS Active Care and they work 10 or more hours per week, they can stay enrolled in TRS Care Medicare Advantage and decline TRS Active Care, or they can decline TRS Care Medicare Advantage, enroll in coverage with their employer, and re-enroll in TRS Care Medicare Advantage as a special enrollment event when they leave that job. Or they can stay enrolled in TRS Care Medicare Advantage and also enroll in TRS Active Care. Keep in mind, if you select that last option, you'll pay a minimum of 3 premiums, including 2 to TRS and 1 to Social Security for that Medicare Part B. All right, we're almost at the end of the presentation, and I want to state clearly what I've implied so far. After retirement, retirees and surviving spouses cannot re-enroll in TRS Care at an annual enrollment event or just any old time. Like a previous slide said, you have 3 chances to enroll: when you retire, when you turn 65, and if you have a special enrollment event. Keep in mind that special enrollment events are rare and usually not a good thing. And the last option, of course, is that limited time enrollment opportunity, which is available through March 2026. How can you keep up with important information at TRS? You can subscribe to My TRS, which is an online portal from the TRS website or the address on the slide. After you create an account, you'll have access to many self-service options. You can use My TRS to update your contact information, plan for retirement, communicate with TRS, and keep track of your personal account and more. We do continue to add new features to My TRS. And a side note that I recently learned about, it was a cybersecurity tip from one of our IT directors about the importance of claiming your My TRS account. If you haven't done so, be sure to log in to access your information to keep your account secure. And the Pulse is a digital healthcare newsletter for active members, retirees, healthcare participants, dependents, or anyone else interested in TRS healthcare news. It does feature informative articles on how to get the most out of your health plans and stay on top of your health. You can subscribe at the TRS website or with the QR code or link on the screen. That link is also in your important contacts handout. And that is the end of the presentation.